As far as patient selection for these therapies, what things come to mind as far as who would be a good candidate for a drug in this class, either Alpelisib or Capivasertib?
Yeah, I think one of the biggest challenges, of course, is hyperglycemia, because that is a toxicity that requires a patient to be very aware of the monitoring requirements, how often they need to be tested, how often they need to come in, so that we can monitor the fasting blood sugar and make sure that our sugars are staying within range. And so making sure that the patient is aware and able to commit to those testing requirements, and then also whether they have any underlying diabetes or risk factors for diabetes, and do we need to think about prophylaxing those patients, are really important considerations before thinking about either of these agents.
Yeah, absolutely. So toxicity is a really big issue when you're targeting the PI3 kinase pathway in general.
Mm-hmm.
As far as class effects, we know that these drugs can cause hyperglycemia, they can cause diarrhea, they can cause rash, all of those, and somewhat edema, are sort of class effects for most of the drugs that we know can target this pathway. Um, some have higher rates than others. And I think that that is something that really weighs heavily into my decision of which
Mm-hmm.
drug to choose.